How can athletes avoid plyometrics overuse injuries? Have you ever wondered how athletes can stay strong and powerful without risking injury during their plyometric training? It's a great question, especially since plyometrics involve explosive movements that can take a toll on the body. Let's break down some effective strategies to help athletes avoid overuse injuries while maximizing their training. First, it's important to understand that plyometrics include high-impact activities like jumping and landing. These exercises put a lot of stress on muscles, tendons, and joints. Overuse injuries can happen when the intensity or frequency of these activities goes beyond what the body can handle. To prevent these injuries, athletes should start with a progressive loading approach. This means beginning with low-intensity drills that focus on mastering the basics, like landing mechanics. As athletes become more comfortable, they can gradually increase the intensity and complexity of their exercises. This helps the body adapt to the demands of plyometric training. Next, mastering proper technique is key. Athletes should focus on landing softly, keeping their knees aligned over their toes, and using their muscles to absorb the impact. By teaching safe landing mechanics, the risk of injuries to the knees and ankles can be significantly reduced. Another important aspect is neuromuscular control training. This type of training helps improve coordination and muscle activation, especially in the muscles around the knees. When athletes have better control, they can handle the forces from plyometric exercises more effectively, which lowers the stress on ligaments. Recovery is also essential. Athletes need to allow enough time between plyometric sessions for their bodies to repair and adapt. Overtraining without proper rest increases the risk of injuries, so scheduling adequate recovery days is vital. Individualization is another strategy to consider. Each athlete has different needs based on their sport, fitness level, and injury history. Tailoring plyometric programs to fit these factors ensures that training is effective and safe. Including eccentric conditioning is beneficial as well. Eccentric muscle contractions, which occur when muscles lengthen while under load, help prepare the body for the stresses of plyometric training. This conditioning can reduce the risk of re-injury. In rehabilitation settings, plyometric progressions can be particularly useful. They teach athletes how to absorb force and develop power without overloading sensitive areas. Skipping these steps can slow recovery and increase the chances of re-injury. To start, athletes should incorporate simple drills like hopping or low box jumps. Focusing on controlled landings and stable joints is crucial. As technique improves, they can gradually introduce more complex drills like bounding or depth jumps. Monitoring for signs of fatigue, pain, or changes in movement patterns is critical. This helps adjust the training load as needed, ensuring that athletes stay healthy while they train. By following these strategies, athletes can effectively balance their plyometric training with the need to avoid overuse injuries. This careful approach not only boosts strength and power but also keeps athletes safe and ready for competition.